Hello, everyone. My name is Emily Griswold, and I'm an Associate Director at the Carter Center in Atlanta in the river blindness, lymphatic filariasis, and schistosomiasis programs. I'm presenting our project, which is evaluating a transition to government ownership of schistosomiasis and soil-transmitted Helminth control programs in 4 districts in Nigeria. I would like to thank my co-authors and co-leads on this project, Dr. Emmanuel Emukah, Dr. Abel Eigege, Lindsay Rakers, Thrash, Jayden Gallagher, and Dr. Gregory Noland. The primary activities in schistosomiasis and soil-transmitted Helminth control programs, also known as SCH and STH, are the delivery of drugs like mebendazole and praziquantel to children at risk in low and middle income countries. International NGOs like the Carter Center support some of these activities through technical assistance and financial support. The primary and secondary questions of this project are to see what happens to the performance of the program in terms of coverage of these drugs, and then also to find out what happens to the program itself and the personnel involved with it as the transition to full ownership by the government occurs. We are using 2 main methods to answer these questions. First, we are conducting household-based coverage surveys in each of the 4 study districts after the most recent round of mass drug administration, otherwise known as MDA. We will do 1 survey before we transition support to complete ownership by the government and 1 survey after. We are also doing a series of in-depth interviews and focus groups with personnel from throughout the health system to better understand how the support from organizations like the Carter Center is perceived and what effects may or may not occur after the transition to full ownership by the government. We are working in 4 districts of Nigeria, which are located in the central and southern parts of the countries. The districts are Agor, Ughelli South, Bassa, and Mwamba. These are complex programs with a variety of stakeholders whose aim is to reach the least accessible communities and the most at-risk populations. Therefore, we must work closely with all aspects of the government, closely with communities and leaders within them, and also work with other international NGO partners who may be supporting similar programs across the country. So far, we have conducted 1 round of coverage surveys with quality data from 3 of the 4 LGAs. We've also conducted extensive focus groups to help plan the program and key informant interviews throughout the 4 LGAs. Interview participants highlighted the strengths of the program, such as training, field supervision, the distribution of drugs that is free and widespread, and also the support offered from the Carter Center to help supervise and coordinate the various aspects of the program. Informants were deeply appreciative of the help from the Carter Center, and they are generally doubtful that the program will be successful after the Carter Center removes its support. They are skeptical that the government will be able to support all aspects of the program and to maintain the performance as has been typically seen. They wanted the transition to take place over a longer process with a stepwise transition so that the removal of support is gradual and partial over the next coming years, rather than complete cessation within the year as is expected within this project. We've noticed some challenges as we've undertaken this project. Our interviewers are skilled and have done an excellent job conducting the interviews and focus groups. However, we noticed that they have not delved into some of the details and nuances that they may understand as people who are very familiar with the program, but other readers and reviewers may not be as familiar with some of these concepts. In order to address that, we will conduct additional trainings of interviewers and expand on our interview guides to help elucidate some of these themes as they arise. We also encountered problems in 1 LGA where the MDA did not coincide well with the school schedule. This means that the coverage that we observed is unusually poor. It's not in keeping with the historical coverage from this LGA. We suspect that MDA did not actually reach many parts of this district. We are working with the program to address these weaknesses and reevaluate the data from this LGA and see what can be done in the future. We've also noticed that many participants in their interviews want the transition process to be much longer and much more gradual. This is beyond the scope of this project. What we will do instead is we will clearly document what specific support they want over time, and we will work with the government to plan for a full transition, taking into account these needs and concerns expressed by the participants. Although we are still quite early in this project, we are gaining excellent insight into how an NGO's support is and isn't relied upon in a long-standing NTD program. This will be helpful to other participants who are considering integrating their campaigns into primary health care. We've also learned that it's very important to begin querying participants about transition perspectives early. Because most of the participants want this project to take longer than it will, we need to know more about how to make that transition as smooth and painless as possible. We've also learned, although we've always known this is important, we've learned that widespread advocacy and sensitization throughout the government and throughout communities is really important to keep the program performing well. This promotes awareness and engagement and makes sure that everyone knows what to expect and how to participate in the program. We also know that there may be other ways that NGOs can help support these programs in the future, as they are more increasingly handled by host country governments. So this might be through supplementing specific efforts and providing specific resources. This is hopefully an approach that will be more sustainable in the future. Thank you very much, and we welcome all questions about our project, and we hope to hear from you soon.